So a very good evening everyone. A very good evening everyone. Hope I am audible and visible to all. And a very good evening. So today we have gathered to discuss the FMGE Psychiatry recall which happened yesterday, the exam, and I hope the exam went really well. So receiving the questions of psychiatry up till now, it seems psychiatry was not that difficult. Good evening. A very good evening everyone. Right, I hope all of you are now relaxed. So it's a time to relax yourself, unwind yourself. You have worked really hard for that exam and now finally the exam is over. So I'm sure by now you must have analyzed and in fact over-analyzed the paper. So we'll try to again analyze psychiatry questions. Again, the purpose is so that we can get an idea what type of questions were asked, and also this will be useful for the future aspirants who will be giving the exam. A very good evening. A very good evening everyone. Again, just a disclaimer, the questions we are trying to gather all the questions, so I'll need your help as well. Let me know if there are any corrections with the compiled questions I have, and we'll try to put the questions again in the app as well. So when we analyze the paper, thank you so much. Receiving messages, yes, happy that questions came from LRR, even from the main videos, rapid revision videos. So from the questions we have gathered, it appears that we had around 5 to 6 questions from depression. Again, depression is a topic which they are asking again this time, although only one question was from depression. Anxiety disorder also there was one question. Substance, again we have been discussing again and again. Substance is a very important topic, and it appears again they have repeated the trend of asking questions, that too from again alcohol. So alcohol is one of their favorite topics which they have been repeating. Eating disorder, again we were expecting that some question may come. Even in LRR we discussed, and also I'll talk about one question. It appears that maybe one question also came from dementia. Again, dementia is an important topic. We'll talk about that question as well. So let us begin our discussion. So this is the first question. Please have a look at this question and also the option. The patient is complaining of low mood, decreased interest and no hopes of the future, decreased sleep. The patient had a similar episode in the past 5 years back. So again, if we can appreciate, currently it appears that the patient is having MDD, major depressive disorder, right? And also he had a similar episode in the past. So patient currently is having a depressive episode, and they say that 5 years back also the patient had a similar episode. So this is the second episode which the patient is having, and the patient recovered, in between. So in between, as you can see, the patient become normal. So the options are depression or MDD, recurrent depressive disorder, dysthymia and cyclothymia. So what is the right answer here? I hope this is the question. Okay, so yes, that was one. Thank you. So 5 years, some say it was 5 months. Okay, right. So okay, so we'll keep this 5 months. Okay, so 5 months back, right, he was all well. So this was the question, and I hope these were the options. So what is the right answer from the question? As we can see, the patient is having depressive disorder recurrently. So this is the second episode. So what is the answer here? The answer here is, it is recurrent depressive disorder. Okay. Yes, so 5 months, yes, we can keep 5 months. So again, this in fact we have also discussed in the main videos. We have talked about recurrent depressive disorder, and in that video we have talked about this. If a patient has 2 or more episodes of depression, so then we call it as a recurrent depressive disorder. So this is the first episode. So this is, again I've taken from the main video, we've discussed this, and also we've discussed that in between, good evening everyone, in between the person should be normal for at least 2 months. So if the person is in between normal, or the person is not fulfilling the criteria of depression in 2 months, then we call it as a new episode. So here they have given, as you are saying, 5 months. So then it is a new episode. So the answer is recurrent depressive disorder. I hope this is clear to everyone. I hope no doubt between dysthymia, cyclothymia, these are more of persistent mood disorders. In dysthymia, patient has depressive symptoms, while in cyclothymia, patient may have symptoms of depression or manic symptoms, and these symptoms are persistent for 2 years. So in dysthymia and cyclothymia, the patient is having persistently these symptoms for 2 years. So that is dysthymia and cyclothymia. While as they have mentioned here, in between the patient has recovered. So that means these are 2 separate episodes. So I hope this is clear to everyone, right? Okay, so even if it is 5 months or it is 5 years, the answer remains the same, isn't it? Because I have just told you, we have also discussed this in main video, that if the person is not having in between for 2 months at least, not having or fulfilling the criteria of depression, then we'll consider the second episode as a new episode. So I hope this question is clear to everyone. Very good. Let's now discuss this question. Again, I would require some help because I have two pattern of question. Some are saying that the diagnosis was asked and some students said that the treatment was asked. So tell me whether these two are the same question or they were different questions. So the question is, a chronic alcoholic patient consuming alcohol for the last 20 years had his last drink 3 days back. So he is stopped taking alcohol and comes to us with altered sensorium, disorientation, tremors and also insects crawling on the body. Please remember this. So again, some students have, I think they said that this was given and they have also talked about cocaine. I think cocaine was not mentioned. So please remember, we've talked about this, that hallucinations can occur, but tactile hallucinations can also occur. So was diagnosis asked or was the management asked, right? So I hope this is clear to everyone. It was the same question. अच्छा, इसमें initial treatment पूछा था, so they had asked initial treatment or they had asked the diagnosis. I'm sure now you can make the diagnosis. Let's make the diagnosis. So all of us know now the patient is having altered sensorium, disorientation. So there is impairment of consciousness. Okay. Okay, so treatment, I'll ask that question, I'll discuss that question if you're saying it was treatment. So I hope this is clear, that the diagnosis is clear to everyone. The diagnosis is delirium tremens. I think that question of ataxia was different. So I've got two questions. So one question, it seems it is delirium tremens, and whether you tell me the question was asked on diagnosis or treatment. So I hope this is clear to everyone. So the diagnosis, I'm sure it is clear. This is the second question. Some students said that this was the question, that what is the treatment, what is the initial choice of treatment. So tell me, was this the question? So I made both the questions so that you can tell me that whether they had asked the diagnosis or whether they asked the management. Okay, treatment was asked. Okay, so management. So now can you say, so we have just discussed that it is delirium tremens. It is delirium tremens. Patient is in withdrawal state. Patient is in withdrawal state. So now what is the treatment? What will be the treatment here? We know. Yes, so we know that patient is in withdrawal state. So alcohol withdrawal treatment we know is benzodiazepines. So tell me, was there any option in which benzodiazepine and thiamine together were given? Was there any? Okay, tell me what were the options. Okay, please help me out in the options. Haloperidol. Okay, it was one option you're saying is thiamine plus dextrose. Okay, one option is thiamine plus dextrose. Okay, fluid was given. Okay, okay. So tell me the options. Okay, was benzodiazepine like lorazepam mentioned in the question? Let me know if these were the options. Okay, so tell me, just let me know if you think that there were some other options. We'll add all those options so that we get an idea. We have discussed this, I think, for in detail, this topic. Okay, risperidone tha. Okay, haloperidol, or let us say it was risperidone, another antipsychotic that mentioned. Okay. Now please remember this, they are asking, this is delirium because of alcohol withdrawal. So this is delirium tremens. This is not a question of just delirium, this is a question of delirium tremens. Please remember this. So we know that treatment for delirium tremens is benzodiazepine. So we have discussed this, in fact, even in the LRR we have talked about this, even in rapid revision and main videos we have talked about this, that patient after stopping alcohol develops tremors, alcoholic hallucinosis, seizures, then delirium tremens. These are withdrawal symptoms. And how to identify delirium, we have discussed. Delirium we have identified when there is impairment of consciousness, and I hope you remember these important points. If any of these points are mentioned, this is telling this is delirium tremens. Okay, so these were the options. So if when we talk about the treatment, again treatment also we have discussed. So treatment of alcohol withdrawal. So withdrawal of hallucinations are there in the withdrawal, or there is delirium tremens, we give benzodiazepines. So benzodiazepines are the treatment of choice, and plus along with this we also add thiamine. So if benzodiazepine plus thiamine is there, that will be a better answer, and if we have benzodiazepines separately, then that will be the answer. I hope this is clear to everyone. I hope this is clear to everyone, right? So I hope any other doubts in the options. So we have also added thymine plus dextrose. Please remember the patient has alcohol withdrawal. So benzodiazepines will be given. If benzodiazepine plus thymine is there, that will be a better answer. So since we have only benzodiazepine in one of the options, then we'll go with benzodiazepine. Okay, right. Okay, so the answer is benzodiazepine. I hope this is clear to everyone. So we have discussed about this. Right now, there was one more question on alcohol. Tell me if this question was there, because there was one more question. Okay, tell me, was nicotine an option? Let me know. Was this question there, that a patient consuming alcohol comes with confusion, ataxia, diplopia? Was this question mentioned in the exam? It seems like a case of Wernicke's encephalopathy. Was this question there? Yes. So yes. So I think this question have also, some students have said yes, this question was there. So don't confuse this question. Again, we have talked about this. Alcohol induced neurocognitive disorder is one topic which they are repeating again and again. Even in INI-CET exam, which happened just recently, there also a question came from alcohol induced neurocognitive disorder. Yes. So tell me, here the patient is having, I hope this is clear, here the patient is having do you remember the mnemonic GOA, global confusion? So we have discussed this also, even in LRR we have talked about this, that alcohol induced neurocognitive disorder. Remember this? So Wernicke, please remember, here they have not mentioned that he is in withdrawal state. These are alcohol induced neurocognitive disorder. So both are two different concepts. Please remember this. So in Wernicke's we remember it with GOA. There is global confusion, ophthalmoplegia. So ocular signs and symptoms, here patient is having diplopia and ataxia. So it occurs because of vitamin B1 deficiency, right? So the answer is thymine. So just have a look at the options. Let me know if these were the options or were there any different options. Okay. Okay, so I hope, let me know. So we have thymine is there in the option. Okay, right. So the answer is thymine. I hope this is clear to everyone. Yes, we can give, always in these patients, please remember the concept here. Always in these patients, we will give first thymine will be given. So thymine will be given first, then we can give dextrose as well. So we will not give dextrose alone, because if you give dextrose alone, it can again increase Wernicke's encephalopathy. So this is a very important point. It will always be thymine before or thymine with dextrose. It will not be dextrose followed by thymine. So this is a very important concept. Please remember this. Yes. So they have asked the treatment. I hope this is clear to everyone. So the answer here is thymine, right? Now let's come to the next question. Again, a simple question. Okay, there was no dextrose. So I hope these were the options. Very similar options I've got, right? So I hope the concept is clear. Thymine here we'll give. Please remember, earlier question was alcohol withdrawal, and this is alcohol induced neurocognitive disorder. So these are two different questions. Okay, now please see this question. So again we'll see that questions on alcohol are getting repeated again and again. Now let's come to this question again. Interesting question, simpler question. So tell me if this was the question and these were the options. I've got 5 options. Let me know which one was not mentioned. A patient has fear of tall building or heights. What is the likely diagnosis? So it seems that he is having anxiety in a particular situation. So we have discussed this, that when a person has anxiety in a particular situation, so 3 phobias we have talked about: agoraphobia, specific phobia and social phobia, isn't it? Right. So okay, acrophobia, very good. So I hope this was nomophobia also there in the option. Very interesting option they have given. Was nomophobia there? The answer is okay, C wasn't mentioned. Okay, C wasn't mentioned. So okay, we'll remove that. Okay, so these were the options. Right, was not. Okay, so I hope this is clear. So the answer I think is clear to everyone. What is the right answer? Yes, it is acrophobia. We've discussed this. Acrobats, they do stunts on height. Acrophobia. So we've discussed this. Anxiety disorder, again a very important small topic, but they seldom ask questions from this topic. This time again they've repeated. So panic disorder, all of us know, sudden onset of severe intense anxiety with feeling of impending doom, and we have discussed that there are again 3 phobias, and the question which they have asked is on specific phobia. In fact, we have discussed even in the main videos, we have talked about this. Acrophobia is fear of heights. Okay, right. So the answer is, I hope this is clear. Okay, nomophobia was not there. Okay, nomophobia, okay, we can just discuss fear of being without mobile phone. So again, again recently term which is used, a disorder. Nomophobia means no mobile phone phobia. Okay, so this was not there. Okay, if it was not there, still we know the answer. The answer was phobia. I hope this is clear to everyone. The answer is acrophobia, right? Now let's discuss the next question, right? So this question again, let me know if this was the question and these were the options. I got, you know, some students said there was obesity, some said that was OCD was there. So just see the option, a girl. Okay, I'll discuss Samarth. Yes, so I was getting that question, prosopagnosia. I'll talk about that. Yes, I got some students having that query. We'll discuss that also. Yes, so girl, child, you know, eats food, or some mentioned that it was burger at one go, or she was eating fast food, you know, at one go. So she is eating, you know, large amount of food in less time, and this is followed by self-induced vomiting. So can we say that there is episode of binge eating and self-induced vomiting, that is purging? Very important is that they've also mentioned the BMI. Okay, yes, yahi tha almost. Great. So I hope this is now a fairly simple question. I hope there is no doubt. Tell me. So please remember, in anorexia nervosa there is restriction of food intake. There is very important point which you should remember, that the weight or the BMI here is decreased. We have discussed this again and again, that for anorexia nervosa there is a decrease in weight or BMI. They have, you know, mentioned the BMI is high. Binge eating, as the name suggests, there will be no purging, no compensatory behavior. Here the person is having compensatory behavior. So the answer is very good. So the answer is bulimia nervosa. Very good. I am very happy. Yes. So again, this topic we have discussed both anorexia and bulimia nervosa even in the LRR. So again, we discussed that it is a small but important topic, and this time they asked a fairly, you know, simpler question this time. So I hope this is clear to everyone. All right. Obesity is a complication which can occur. More commonly it may occur, obesity complication may occur with binge eating disorder, right? So please remember, right? Now there was one more question. Let us just have a look at this last question. So tell me, were there any other question? This question also I got from some students. Please see, was such a question asked, prosopagnosia, what is it, what this asked, and please help me out with the options if you can recall. So prosopagnosia, we know, agnosia, we know there is you know, inability to process sensory information like identifying object. So it's a agnosia. Prosopagnosia means inability to recognize faces. So we have discussed this in, you know, when you're discussing dementia. In dementia we discuss amnesia, there is aphasia, apraxia, agnosia. Was this question, was this asked? Okay. Tell me what was one more question was there. Phobia, one more question, let me know what was the question was. So was this question, please help me out, was prosopagnosia question was there, prosopagnosia question was there, and what were the options? I've only been able to gather these options. Were they just directly asking that what is prosopagnosia? Right. So I hope this is clear. Inability to perform movement, this is apraxia, we know, this is apraxia, we know this. So we know it's a cognitive impairment we have discussed. Inability to speak, aphasia is there, So I hope you have marked it correct. In fact, even in the main videos, you know, we have talked about this when I have discussed agnosia, when I have discussed, you know, cognitive impairment. So there, in fact, I have discussed prosopagnosia also in the PrepLadder main video. So we have discussed this point. Okay. Right. So tell me, what was the question on defense mechanism? Okay. There was one more question on defense mechanism. Somebody saying, can you please let me know what was the question on defense mechanism? So we'll have, you know, we'll discuss this question on defense mechanism. What was the question? Displacement is a defense mechanism. Yes. Can we let me know what was the question on defense mechanism? Let's try to, you know, so what was the question on defense mechanism? Displacement is yes. So dementia treatment was there. Okay. So I'm getting some newer questions. Let me know. So you're saying there were some more questions. Okay. So there were some more questions. Let me know. Defense mechanism, we'll have one question. I'll try to compile this question. Let us see if we can compile right now. So we'll discuss defense mechanisms. Options were displacement. What was the question? If you can let me know, what was the question? Displacement was one of the option if a person is in stress or problem. All are defense except, they had asked. Okay, they had asked all are defense except. Okay, so this was the question you're saying. Okay, all are the following are defense. Okay, so I've got this question. So right, so one you have mentioned is displacement was mentioned. Can you tell me all the other options? Displacement is a defense mechanism, we know, right? So defense mechanism, basically these are tools defense mechanisms basically are tools used by ego to handle stress. Okay, so usually they are unconscious, they are used by the unconscious mind. So whenever there is stress, the ego tries to decrease the stress by using these tools which are known as defense mechanisms. So replacement is not a defense mechanism. Rationalization is there, yes, rationalization is a defense mechanism. Rationalization is a defense mechanism. Okay, you are saying replacement was there, and rationalization I have mentioned. Replacement you are saying was there, good, I am happy that you are giving me the options. Okay, any other? What was the last option? Treatment of dementia, I will talk about that also. Okay, you are mentioning even treatment of dementia question was also asked of dementia. Okay, so let us try to, yes, okay, regression, yes, so regression is also a defense mechanism. Were these the options? Let me know. So the question was, they had asked all are defense mechanisms except. Again, in the main videos we have talked about these defense mechanisms. Replacement is not a defense mechanism. Okay, replacement, if these are the options, then it is replacement. Cooperation was there, again that is also not a defense mechanism. Okay, so if any person is in stress, problem and difficult situation, then option rational. Okay, so basically again you are saying that the question was, if anybody is in stress, so then which of the following defenses may be used? Okay, or all are used except. Okay, so except was asked. Okay, right. Okay, so then here, as I have told you, out of these four, replacement is not there. Okay, right. So except, we have discussed this. Okay, so the question was not a direct question, but they are given that somebody is having stress and how to cope. Okay, so this was the question. Okay, right. So which of the following is not the defense mechanism? So that is the question. Okay, right. So tell me, what was the treatment you have asked? Treatment of dementia. Can you tell me the question? Somebody has asked. Lone Khalid, you have asked treatment of dementia was asked. Can you tell me the question? Please remember, delirium question was asked. I think some have confused delirium wala question that was asked. Delirium tremens. Please remember, delirium tremens we have just discussed. The treatment is benzodiazepine. Okay. Okay. There was. So what was the question on dementia? Can you tell me? Okay, treatment of dementia. Can you tell me the four options? Very good that you are helping me with more questions were asked. So I was of the opinion only 5-6 questions were asked. I think it appears there were more questions. Okay. So memantine is one of the drugs. Memantine is drug. Was memantine there in the option? Memantine. Was it like this? Compensation is for which question you are saying? Compensation was in this question only. Defense mechanism you are saying. One of the option was compensation. Is this correct? Is this what you are saying? That compensation was one of the options in the defense mechanism wala question? Yes or no? Shreya Reddy, let me know if you are saying. Okay, the question was on dementia. Okay, so I am asking what was the question. Can you tell me the question which was there on dementia? Okay, good that I am getting this question. What was the question on dementia? Not on dementia treatment. Okay, so let me know. Okay, there was no question on dementia. Treatment of dementia you are saying. Okay, so let me know if you are able to remember the question or the options. Okay, because this question I have not got. Acha, if compensation, if replacement is not there, then you can go with compensation. Okay, then you can go with compensation. So either of these two may be the right answer. I'll try to gather the question again. So either of these two, A, B, these three we know these are defense mechanisms. Okay. That haloperidol clonazepam, I think you are confusing with this question. Let me just show you that question again which we have just discussed. Please see, this is the question we have discussed. A patient having a delirium and it's alcohol withdrawal delirium. Achha, rivastigmine was given in the options. Okay, so I think now I am getting some options. Rivastigmine was given. Rivastigmine. Okay. Rivastigmine. I hope defense mechanism wala question, I think we are able to get that question, right? So tell me, rivastigmine was there. Okay, replacement was not there, compensation was there. So that will be the answer. Then as I am saying that it appears either replacement or compensation, either of the two was the answer. Okay, because A, displacement, rationalization and regression, these are defense mechanisms. Okay, right. I hope this is clear to everyone. Okay, so replacement I have replaced and I have added compensation here, and that is the answer right now. Okay, so okay. Tell me, it was replacement or displacement? If you might be confused, is it a replacement or displacement? Both were there. okay, for sure. So then whatever be the option we have discussed, either of these two would be the answer then in this case. And anybody can tell me the question on dementia treatment. Rivastigmine, I have got one option. If you can let me know. So let me know if all of us agree there was, okay, so let me know all the other options then. So I think yes, so this question I think we will again gather all the options. Okay, the question I think is mostly we have got clear, and we'll try to collect all the options. Okay, so can you help me with this dementia question? Can you tell me dementia was there? No question on dementia, no such question. Okay, so let us put a query then. You're saying okay. So maybe you can message in the Facebook group, PrepLadder group, you can let me know if the question was there. We'll try to again recollect that question if dementia question was there on treatment. So we know, we have discussed about the treatment. We know cholinesterase inhibitors are there, such as donepezil, there is rivastigmine, galantamine, then memantine is there, and newer drugs, aducanumab is there, then lecanemab, and a newer drug which is just approved few days back, donanemab. Okay, so those were the treatment. Okay, so I think we are getting confused between the two questions of delirium and dementia. Maybe if there is a question on dementia, we will try to collect it. Okay, so I will try to collect the question with the options, and so that we can again come back to the answer. Okay, some of you are saying there was no question. Okay, so I think most likely these were the questions. This again I will show you. Let me know this question was there and these were the options. If you can help me out with the last option here. Okay, so this question I think this was there, no? Yes, so yes, question on dementia again they have asked. So organic mental disorder, neurocognitive disorder is a topic which they are asking again and again, and this time in the form of symptom they have asked. Okay, so I hope this is clear to everyone. So basically the topics are repeated, again, and a newer question they are making again a message for the future aspirants. So new questions are being made, but again you can see the topics they are getting repeated. Okay, so I think for now these were the questions we have got. And again, thank you for your time and my best wishes to all of you. Again, this time is yours. Enjoy your time. Do things which you have been postponing because of the exam. Spend time with the family. Watch your favorite series on Netflix, Amazon, whatever you have been wanting to do. And don't overthink about the results. It will be good. Keep smiling and keep moving forward. Okay. So thank you very much. May God bless you all.